Good day all, my name's Simon Brazier, your health renegade. I hope you're all happy and well. Today I'm going to be talking to you about Alzheimer's disease, and I'm going to tell you the top therapeutic substances related to treat, some problematic substances, and some conditions that can actually mask themselves as Alzheimer's disease. So Alzheimer's is one of the most common forms of dementia, and it's defined as a serious loss of cognitive function in previously unimpaired people beyond what is expected from normal aging. A 2006 study estimated that 26 million people worldwide suffer from Alzheimer's, and by 2050 that's going to quadruple. So 1 in 85 people will be afflicted with the disease. The current medication used to treat Alzheimer's disease attempts to increase neurotransmitters in the brain. These are brain chemical messengers that our brain cells use to communicate. But what's really now apparent is that these drugs only offer momentary palliative improvements. And in fact, we're now seeing that these drugs actually cause more serious neurological problems. A promising new perspective on Alzheimer's disease looks at the role of age-induced brain calcification, and this is the accumulation of calcium salts in a particular part of the brain. The pineal gland calcification is now actually found in 2/3 of the adult population, which is a really scary piece of information. One likely culprit for this has been found to be fluoride. The pineal gland is this small part of the brain that releases one of our most important hormones, melatonin. So if we have a calcified pineal gland, our ability to make melatonin decreases, right? And melatonin protects us from over 100 different health conditions, including many lethal cancers. Also, melatonin helps us sleep, and sleep is arguably our most important health beneficial activity. So avoiding toxins, reducing stress, and shifting our brain energy source from glucose independence to more of a fat-based diet is definitely the way the science is looking towards. The main problematic substance with Alzheimer's disease is aluminium. And we're bombarded with this metal every day. It's in foods, vaccinations, medications, baby products, cosmetics, cleaning products, and even soft furnishings contain aluminium. We know that it accumulates in the body and can cause harm wherever it ends up, but at some point in the brain, the accumulation reaches a toxic threshold. The brain cells stop being able to deal with the accumulation, and the exposure ends up degenerating cells and killing them. Recent studies show that aluminium plays a huge role in most cases of Alzheimer's disease. So now coming out now is drinking silicon-rich mineral water is now looked at to protect the body against this aluminium toxicity. The silicon helps aluminium be excreted via the urine. And a really cool Malaysian company and some UK scientists have partnered up to produce a silicon-rich water source. And I'm going to put the information and link of a really cool article below in the comments. So therapeutic substances, good news for what we can do. So number one is going to be turmeric. And turmeric is talked about a lot. It's been used in India for about 5,000 years and probably why still today in both rural and urban populations, they've got some of the lowest Alzheimer's rates in the world. A recent study on patients with Alzheimer's found that using less than a gram daily, taken for 3 months, resulted in remarkable improvements. So try incorporating small, high-quality culinary doses of turmeric into your daily pattern. Number two is going to be coconut. So this remarkable substance contains about 66% medium-chain triglycerides by weight, and it's capable of improving symptoms of cognitive decline in those suffering from dementia by increasing brain-boosting ketone bodies, and perhaps more remarkably, with only one dose and within only a couple of hours. Other important therapeutic substances include sage, B vitamins, cacao, resveratrol, ginkgo, lemon balm, and saffron. Now I'm going to give you some information about conditions that mask themselves as Alzheimer's disease. So there are many conditions that do this. So I think it's really important to be aware of these. So number one is going to be nutritional imbalances and deficiencies, such as omega-3s, vitamin B12, vitamin C, and magnesium. The next one is going to be artificial food colors, flavors, and sweeteners. So artificial additives of all kinds may cause dementia symptoms. Prescription medication, side effects, so drugs, especially pain medication and psychotropic drugs, can cause severe um, disruption to cognition. Inflammation and low level infections, mold, food allergies, and Lyme disease also cause Alzheimer's disease symptoms. Stress and stagnation and inactivity does it. Thyroid and other hormonal balances also. Mercury and other heavy metal poisonings is also very much correlated to Alzheimer's disease symptoms. The results from a new study into Alzheimer's disease is showing that by simply just doing exercise decreases your risk of Alzheimer's disease development by 50%, which is crazy. Higher levels of activity have shown a significant increase in the amount of brain grey matter that's produced. We live in a time where we've been fairly well trained to expect magic bullets for our conditions. When it comes to Alzheimer's disease, none exist. The important thing to remember really is that our diet and environmental exposures that largely determine our risk of accelerated brain aging is really important to work with. So prevention is an infinitely better strategy. Finally, Dr. Bredesen, a professor of neurology at UCLA, believes that multiple factors influence the development of Alzheimer's disease, and a common protocol that he uses includes eliminating simple carbs, eliminating gluten and processed foods, increasing vegetable, fruits, and non-farmed fish, reducing stress with things like yoga and meditation, taking melatonin to increase sleep to like 7 to 8 hours per night, taking supplements like vitamin B12, vitamin D, CoQ10, and fish oil every day, and also optimizing oral hygiene, hormone replacement therapy, fasting, and introducing exercise for a minimum of 30 minutes, 4 to 6 days per week is a simple part of this guy's protocol. So dementia or not, I think anyone could seriously benefit from a program like this. So that's kind of it. Thank you so much for listening. I hope you learned something. Please subscribe to help me get more information to more people. That's kind of the whole idea of why I do this. My name's Simon Brazier. Thank you very much. Goodbye.